Hi, Mr. Smith.
Hello.
My name is Caitlin. I'm going to be your student nurse doing the head-to-toe assessment. Can you tell me your name and your age?
John Christopher Smith. I am 24.
Okay, thank you. And can you tell me what today's date is?
It is December the 2nd, 2018.
Okay, thank you. Can you tell me where you are?
I am in Battle Creek, Michigan
Okay. And can you tell me why you were here?
for a head-to-toe assessment.
Okay, thank you. So I can see from talking with my patient that he is oriented to the situation, he is oriented to the place, he is oriented to person, and his speech is clear, he is sitting upright in a good posture, he appears to be well nourished and well groomed. Okay, Mr. Smith, I'm going to start my assessment by looking at your skin, okay? So I'm going to have you stand up, and I'm just going to take a look at your skin. Okay, I don't see any abrasions or open lesions. I'm going to look at your abdomen too, okay? So I'm just going to lift your shirt. Okay, I do see some moles, but none of them seem to be of concern. And then I'm going to check your legs. I should see a mole. It's not anything abnormal though. I don't see any bruising or abrasions. On the left elbow, I do see an old scar. It's healed though, it's not open. And the back of his legs are good too. Okay. Now, Mr. Smith, you can take a seat. I'm going to inspect your face now, okay, and your head. So I can see by looking at you that your face is symmetrical, so your cranial nerve 7 is intact. And now I'm going to palpate your scalp just to see if you have any lesions or bumps or anything abnormal, okay? So I'm going to touch your scalp. And from palpating, I do not feel any abnormalities. Okay. And now I'm going to have you stick your tongue out, okay? And I see that you're able to do that with ease and no difficulty. And so I know that your cranial nerve number 12 is intact. And so I'm going to touch your face again, just on the side, to feel your cranial nerve 5 is intact. Can you open your mouth for me? And can you clench your teeth? Okay, good. So I do feel that you have your cranial nerve 5 is intact. Okay, and so now I'm going to palpate your sinuses. You're going to feel me push on your face and let me know if you have any pain or tenderness, okay?
Okay.
So I'm going to feel your maxillary.
Nothing.
Okay, and your frontal.
Nothing.
All right, good. Okay. Now, Mr. Smith, I'm going to inspect your eyes. So I can see from here that you have eyebrows and you have eyelashes. So that is all normal findings. I can see that your eyes are both symmetrical and they are opening and closing with ease. Okay, so I will assess your pupil. Well, actually first I'm going to assess the structures of your eyes. So I'm going to touch your face again. I'm going to lift or lower your lid and have you look up. And I can see your conjunctiva is pink, it's not inflamed. Now I'm going to touch your upper lid and have you look down, and sclera is white, no inflammation, and no bumps or lesions. And now on your other eye, I will have you look up. Conjunctiva is pink and intact. And now I'll have you look down. Your sclera is white, no bumps or abnormal lesions. Now I'm going to check your pupils, and so I will have you look straight ahead and focus. I'm going to shine a light so I can see that your eye reacts to the light, and now I'm going to check this eye as I'm shining in this to see if it accommodates, and it does. Okay, now the same on this eye. All right, so his right eye reacts and then his left accommodates. Okay, and your pupils are round and reactive. Okay, so now I'm going to check the corneal light reflex. So I have you focus on something straight ahead, and I'm going to shine this light about 2 feet away just to see if I can see the 2 pinpoint light, and I do. So your corneal light reflex is intact, and now I'm going to check your cardinal positional gaze reflex, so I'll have you focus on the end of my pen, okay? And then just follow it with your eyes, not your head. All right. Okay, so your eye movement is natural and good and it's intact. All right, Mr. Smith, I'm going to have you look at this eye chart for your near vision and place it where you can see the best and cover one eye at a time. And try to read the lowest line you can.
FDPLNCEO.
Okay, now can you do it with the other eye?
FDPLNCEO.
Okay, thank you. By seeing he had to hold it out a little farther may mean that he needs correctional lenses for his near vision. So Mr. Smith, now I'm going to take a look at each ear. So I'm going to start with this ear and seeing that you don't have any abrasions or open wounds. I don't see any deformities, and I'm going to inspect it by touching it, okay?
Mm-hmm.
And I don't feel any bumps or abnormalities. Do you have any tenderness when I do this?
None.
Okay, and now I'm going to do the same with this ear. And I don't see any deformities or abnormalities. And I'm going to palpate. I don't feel any bumps. And then on your tragus, do you have any tenderness?
None.
Okay, thank you. Okay, so now I'm going to inspect your nose. And so I can see from your nose that it is midline and it is intact. I'm going to palpate it too, so let me know if you have any pain, okay?
No pain.
Okay, and now I'm going to plug each nair and have you breathe through to test for patency. And then this one. Okay, so there is a little congestion, but you did say that you're feeling a little under the weather, right?
Yes.
Okay. All right. So now I'm going to inspect your mouth. So I will have you open your mouth for me. I'm going to use my pen light and to look in. Okay, so I see your mucous membranes are pink and intact. I don't see any open lesions. Your teeth are all there and intact. Tongue is pink and moist. Okay. Can you stick your tongue out for me, please? Okay. And I don't see any tonsils to grade. All right. And can you say ah?
Ah.
Okay. And the uvula is symmetrical and it reflexes to him saying ah. So that indicates to me that his cranial nerve 4 and no, it's actually 9 and 10 are intact. Okay. So now I'm going to inspect your neck, Mr. Smith, and I can see that I don't see any bumps on the side or anything abnormal, no open wounds or lesions. Okay, and can you move your head up and down for me?
Mm-hmm.
Okay, and can you move side to side?
Mm-hmm.
Okay, and can you do a circle for me with it?
Mm-hmm.
Okay, so you have full range of motion with your neck. All right, and now I'm going to test your strength with your neck muscles. So I'm going to put my hands on your shoulders and have you push up. All right, so you got full strength, good strength. Okay, now I'm going to palpate your lymph nodes and let me know if you have any pain. I'm going to be checking for inflammation or any bumps. So your preocular.
No pain.
Okay, and I don't feel any bumps. Postocular. I do not feel any bumps. Occipital. No bumps for me. Any pain?
No pain.
Okay. And then your posterior cervical chain.
No
I
pain.
do not feel any bumps. Your anterior cervical chain.
No pain.
Okay, no bumps. Your tonsillar.
No
I
pain.
do not feel any bumps. Submandibular.
Nothing. No
Okay.
pain.
Submental. I do
No.
not feel bumps.
And no pain.
Okay. And supraclavicular down here.
No pain.
All right, and no inflammation. Good. Okay. So now I'm going to palpate each carotid. So I'll have you just relax. Okay. And the pulse is there. I would grade it at a 2+, and then on this side. All right, and I would grade it at a 2+. Now I'll have you just relax. I'm going to palpate your trachea. And it is midline. So that is good. Okay. Next, Mr. Smith, I will have you take your shirt off so I can inspect your posterior chest, your back, and your chest. Okay, and I'll have you turn around. Okay, so there is a little redness here that's just from sitting in the chair. But besides that, I do see moles that have no abnormalities, nothing to be of concern. Okay, and now I'm going to place my hands here, and I will have you take a deep breath in and out. Okay, so I was testing your chest symmetry with inhalation, and it was good and symmetrical. Okay, and so now let me double check. I'm going to check your tactile firmitis, so I'm going to place my hands at the top. Each time I move down, I'll have you say 99, so I'll have you start by saying 99.
99. 99. 99.
Okay, so I could feel the vibrations through all areas of the back. That means that there's no obstruction or no fluid buildup in his lungs. Okay, and now I'm going to percuss your back. So I'm going to place my hand here and I'm going to hit it, and it should not hurt. I'm just checking to see if you have any fluid buildup, okay? Okay, so I did not hear any dullness, which indicates to me that you have no inflammation or fluid buildup. And now I'm going to palpate down by your kidney just to see if you have any tenderness or pain, okay? So while I do this, let me know if you have any pain. Any pain?
No pain.
Okay, and one more time. Any
No.
pain?
No
Okay.
pain.
All right, now I'm going to listen to your posterior lung sounds, okay? Let me know if you need to take a break, if you get too lightheaded. So I'll have you take a deep breath. Okay, and deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay. Now I'm going to listen to your lateral lung sounds. So I'll have you take a deep breath. And a deep breath. Okay. And I'll have you turn over here so I can do this side. And deep breath. And deep breath. Okay, good. So your posterior and lateral lung sounds are clear in the all fields, so that is good. There's no fluid buildup and no wheezing. And from your anterior chest, I can see that you don't have a barrel chest or any abnormalities. And now I'm going to listen to your anterior lung sounds. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Okay, good. Your anterior lung sounds are clear in all fields as well. Okay. So now I'm going to take a look at your chest, and I don't see any abnormalities in the precordium area where your heart would be. And I'm also going to locate the point of maximum impulse. I'm going to listen. Alright, so it's right here. I'm going to palpate that area to see if I can feel any pulsating or anything abnormal. And I don't. Okay. So now I'm going to listen to your heart sounds. So you can just breathe normal at this point, okay? So I'm going to listen the aortic and the pulmonic. And the tricuspid. Erb's point, and the mitral. Okay, so I am hearing S1 and S2, no abnormal heart sounds or murmurs, so that is good. So now, Mr. Smith, at this point you can sit back into your chair. I'm going to inspect your upper extremities, so I'm just going to take a look at your arms. And all I see are the moles, which I don't see any of concern. Nothing on your hands. Okay. And now I'm going to take a look at this. I don't see anything abnormal. Good. Okay. Now I'm going to test your capillary refill by pressing on each nail. Okay, in this hand, they refill within less than 3 seconds. And then let me check on this hand. Okay, and the same with that, less than 3 seconds. Good. Okay, now I'm going to feel your radial pulse. And I would grade that at a 2+, which is good. It's regular. And now the same on this. And I would grade that at a 2+. Okay. Now, Mr. Smith, can you raise your arms out in front of you? Good. Now, can you raise them out at the side? Okay. And can you raise them above your head? Good. So you have full range of motion of your upper extremities. That is very good. Okay. Now, Mr. Smith, I'm going to have you come and lay on the table over here. I'm going to inspect your abdomen, so I'll have you just lay down and relax. Good. Okay. So just by looking at your abdomen, I can see it is flat. I don't see any distension or anything abnormal. Okay. So now I'm going to listen to your bowel sounds, okay? So you can just relax at this point. So your bowel sounds are active in all 4 quadrants. And now you can just relax. I'm going to listen to see if you have an aortic bruit. Okay, and I do not hear anything, so that is a good finding. Okay, Mr. Smith. Now I'm going to percuss your abdomen. So I'm going to tap on it again like I did on your back, but now on your abdomen. So I'll have you just relax. Did you have any pain or tenderness?
No pain.
Okay, now I'm going to palpate softly at first, then I will do it deeper the next time, okay? So let me know if you have any pain or tenderness.
No pain.
Okay. Now I'm going to do it a little deeper, okay? Let me know, okay?
No pain.
All right. Good. And I did not feel any distension. Your abdomen is soft, so that is good. Okay. Now you can sit back up. I'm going to inspect your lower extremities. If you want to come back over to this chair, sir. Thank you. Okay.
Shirt back up?
You can put it back on, yes.
Thank you.
You're welcome. Okay, I will be taking your socks off though, okay? So I can inspect your feet. Thank you. Okay, so just by looking at your legs, your skin, and your feet, taking a look at your heels especially to make sure you don't have any redness or any ulcers. I don't see anything abnormal. Legs are in the skin are good. Okay. And now I'm going to feel your posterior tibial pulse, okay? So you can just relax at this point.
Somebody intervening.
Please lay down. Okay. So over here I feel it's a +2 posterior tibial. And then on your dorsalis pedis pulse, it is a +2. And then over on this side, posterior tibial, it's a +2. And your dorsalis pedis is +2 as well. Okay, good. Okay, so I'm going to
I think you've heard of doctor-patient confidentiality.
move my puppy, so sorry. And I'm going to lift up each leg one at a time, okay? Just to see if you have any pain
Okay.
and to check your range of motion. So I'm going to lift this leg up. Any pain?
Nope.
Okay. I'm going to bend at the knee, okay? Push it up towards your chest. Any pain?
No pain?
All right. I'm going to also pull it out to the side. Any pain?
No pain?
And then over midline.
No pain.
Okay, good. Same on this side. Going to lift. Any pain?
No pain?
Okay. Bend at the knee and push up. Any pain?
No pain.
Okay. Out to the side.
No pain?
Okay. Past midline.
No pain.
All right. Perfect. So you have full range of motion of your lower extremities. Okay. So I already have you sitting up, which is good. Now I'm going to have you close your eyes, and I have a cotton ball that I'm going to touch on different parts of your body, and I want you to tell me where I am touching them, okay?
Okay. My forehead,
Okay.
my arm,
Okay.
my leg,
Okay.
my foot,
Okay.
left foot.
Thank you. So your sensory perception is intact throughout your body, which is good. Okay. Now I'm going to have you drum on your legs. I'll have you start out slow, and when I tell you to get faster, I'll have you start to go faster, okay? Ready?
Mhm.
You can go. Faster. 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 Good. Okay. So that was testing your so sorry. Your supination and pronation, and you're able to follow my direction and increase your speed, so all of that is good and intact. Your rapid arm movement was good. Okay. Now can you touch your heel on this leg over to your opposite leg and run it down? Okay. And can you do the same with that leg? Okay, good. All right. Now I'm going to test your reflexes, okay? I'm going to use the bell of my stethoscope. And so I'm going to start with your bicep. I'm going to feel right here for the tendon. All right, and you can just relax, okay? Ready? Okay, good. So your reflex is intact. And now on this side. Good. Okay, so bilateral bicep reflexes are intact. Now I'm going to test your knee, your patellar. Okay, I did see a little reaction to that. Good. All right, and now on this knee. Good. One more time. Good. Okay, now I'm going to test your Achilles reflex. So I'm going to have you place your foot in my hand, just so I can feel, okay? Now I'm going to tap. Good. I can feel a little reflex there. And then the same with this foot. Good. I feel the reflex in your toes. Good. All right. So reflex throughout the upper and lower extremities are intact. Now I'm going to check your plantar reflex. So I'm going to brush up towards your toe, okay? Okay. Good. So let me try in this foot. Okay. So your plantar reflexes are intact too, okay?
Okay.
Thank you for that. I know you don't like your feet touched. Okay, so now I'm going to have you stand up, and I will have you stand over by this table. And now I will have you walk towards me. Good. So I can see that your gait is strong, balance is good, and you did not have any difficulty walking towards me. Now I'm going to have you turn around, and I want you to put heel to toe, walking from me to the table, your tandem walk. Okay. Your balance is good. You're able to put your heel in front of your toe. Good. Okay. Now I'm going to have you close your eyes, and I want you to walk towards me. I won't let you fall or anything. I'm just going to check your balance and see if you're good. So you can walk towards me now. Good. Okay. Very good. All right. So, Mr. Smith, let me just take a quick look over everything and make sure. Okay. So by doing that eye closing, I was doing a Romberg walk to test to see if your balance within is good, and it is. So now I'm going to have you turn around. I will lift up your shirt, okay, because I'm going to inspect your spine. And I want you to bend over. Okay. So I see spine is midline. I don't see any abnormalities, any bumps. Okay, now can you stand up? Good. Now can you extend over to your right? Good. And can you extend to your left? Good. Okay. Did you have any pain or difficulty doing that?
No pain. No
Okay.
pain.
So your spine range of motion is full and intact. Okay, Mr. Smith, it looks that you're in good health, and I want to thank you today for letting me do my head-to-toe assessment on you.
Thank you.
Thank you.